This is my children's.
Quality of care here was excellent. We couldn't have asked for a better situation for the situation we were in. We couldn't have come to a better place. We're lucky we have it in our backyard.
We have some of the best, most dedicated nurses here. I am always in awe of how wonderful they are. They're just so caring, and they treat the whole family, which I think is one of the most difficult things for care providers to learn how to do. And our nurses do it effortlessly. They're just amazing. I just can't tell you how proud I am to work with them side by side every day.
Probably the biggest miracle that I witnessed was a little boy who had transposition of the great vessels, had a surgery, went home and was doing great, and came back about a month later and had developed myocarditis, which is a viral infection of the heart muscle. And his heart muscle was grossly damaged, and so the thought was that he probably was not going to survive. And Dr. Pellick was his cardiologist, and he worked with the family and kind of sent him home on some pretty strong medication that was given by IV. And somehow, miraculously, this child turned the corner and went along for another 14 years. And actually, this past January, got a new heart and is doing awesome.
I have had so many patients touch me personally, and every time I think about it, I get a little emotional. But I guess I would think about a particular family that I just had an opportunity to work with over the last couple of years. And unfortunately, she passed away at the age of 5 just last week. So I was attending her funeral yesterday, so it's particularly fresh in my mind. But the family had their way of doing things that was all about the family. The power of that family and what that meant for this girl's life and how they took care of that child. And she was sweet, and she was beautiful, and she was a very strong girl. So to see that in such a young child go through a very, very difficult illness it's inspiring and awesome. And I really appreciate the strength of families when they're able to keep their family together and support the care that children need when they have devastatingly chronic disease.
As a parent, I had a child before, but not a child with special needs, and had no clue on how to take care of my child. And they included me in everything. And so I think we wouldn't have bonded had it not been for Children's.
When I envisioned myself as a little girl, when I knew I wanted to be a nurse, that was kind of what I was thinking. It would be patients that I could know and be a part of their lives.
I love my job. It's just fun. I mean, I can't say that, too many people have the great opportunity to go to work and play with kids.
Having worked with nurses in many different areas, it's clear to me that the nurses here are as good, if not better, than any of the other places that I've ever worked in or been as a visiting professor.
I always ask the kids to, can you draw me a picture? Because I never want to forget, who I took care of. There's so many kids that you see come and go all the time, and so I always be like, draw me a picture, because I have a ton of pictures in my locker of the, drawings kids have done for me.
For me, the biggest thing is through working with kids and working with their families, you get things back that aren't measurable in dollars.
The relationships that we actually have with the physicians, with the residents, with the attendings, with the families, it all plays a huge part of why I love working at CHW.
Virtually to every person, they are passionate about their profession. So they're passionate about what they do and the care they provide for the kids. And I think, the nurses are a huge reason why we provide such outstanding care, why we're a top children's hospital in the country.
Mom sent me a note to say, Evelyn, I just want to say thank you. A handwritten note, all that you do, and you don't do it just for me, you do it for everybody. How you love all of us the same, I don't know. But I feel the love, and I talk to other families, they feel the love too. And that is just a great reward
The nurses in this hospital are some of the best I've worked with around the country. They are compassionate, they're caring, they're very professional, they are detail-oriented, and that includes not just the details of which medicine they've given, but it's how the family's doing.
I always wanted to be a nurse since I was 4 years old. Used to get doctor kits every year for my birthday.
It seemed like every nurse that we dealt with, they would come back and check, even if Caitlin wasn't their patient again the next time that they were on call, they would come back and, how is Caitlin doing? What's going on with her? And it just showed that they weren't just here doing their job. They were here because it was more like family.
I just really appreciate working for an organization where, they support professional development, where I know there's room for advancement, and where there's such a team approach to providing good care.
When I was still in nursing school, I was a recipient of the President's Scholarship that helped me go to nursing school.
Only 2% of all hospitals in the country actually get redesignated as a magnet hospital, showing nurse excellence. And that is such a huge deal, because you think about how many hospitals are in the country, and to be one of the minority that actually gets redesignated is, it's a big deal.
Pediatrics was a little scary when I first came in '86, but when I started with the sickle cell disease program, I saw so many families that were intrigued about learning more about their disease, people having issues that I had learned about or dealt with in the community. And so I got a chance to use a lot of aspects of my nursing, teaching and sharing of information, problem solving, even budget making, trying to help people, set budgets for themselves and figure out how to utilize their money more efficiently.
Now that I have joined and participated in the redesignation, I've learned so much about the organization as a whole, and not only the wonderful nurses and staff that work in my department, but throughout the hospital. I thought we were kind of special, but there's a lot, and we are, but there's a lot of special nurses throughout the hospital that hold themselves and their departments to that higher standard, that being part of a magnet hospital is so important.
I have learned so much through the different positions and the different people that I've had a chance to work with over the years, and particularly I continue to learn every day from the families that I've had opportunities to come in contact with.
Oh my goodness, it's crazy how much you learn in 1 year. It's just amazing. If a year ago, if I would have said, I'm going to be giving chemotherapy, I never thought I would ever be doing that.
Children's, honestly, has been a family to me for 27 years, and it's gotten to be a huge family. The old downtown, you'd go down to lunch and you'd see everybody you knew, and it felt like a family. And the family has grown and changed over time, but it's still a family.
My mom is a nurse, and she takes care of sick children. Thank you for taking care of me.